Good morning, everyone. Dr. Kassam is unable to attend this morning, so I have the opportunity to introduce Grand Rounds. My name is Jennifer Ringrose. Before we begin, I would like to respectfully acknowledge that we are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to enrich our vibrant community. I would like to now introduce Dr. Stephen Russell from McMaster University. Dr. Russell received his PhD in classics in 2011 with a focus on Latin literature and poetry. Since 2012, he has been teaching and researching medical language at McMaster University. His terminology course, both introductory and advanced, have become the most successful ones in the country, with 6 other major Canadian universities currently following his approach of being radically practical in teaching medical language. Welcome, Dr. Russell.
Thank you very much. I can add, I think we've got 7 universities now because University of Alberta is going to be doing it very soon. So to start with, this was a cartoon from the New Yorker back in 2007. I'm a doctor. The doctor says I can add ectomy to any word I choose. This is funny for, maybe not funny on a Friday morning, but this is funny, I say, for people who really don't understand medical terminology. What does ectomy mean? Somebody shout it out. This will be the only involvement I'm asking for this. Removal. Thank you, like that. Okay, we say the cutting out of X. Why would a doctor add that? So basically, what it should be, there's supposed to be, I put a little round thing. It's supposed to be, I'm a doctor, I can add osis to any word I choose. You know, a doctor would say, I can call anything a disorder, a disease. Okay, so I have 2 goals this morning: to teach you some simple and reliable formulas dealing with clinical medical terminology, and there's an ulterior motive. Not a bad ulterior motive. My colleague, Dr. Amanda Hardman, is sitting right there. She and Kelly McFarlane at the Classics and History Department are starting to teach medical terminology here at the University of Alberta. And one of the things I've become, and I will say it, frankly obsessed with at McMaster, is the fact that people who teach medical language, who are usually classicists, never talk to the other side of the university. So I've become very much involved in the last 4 or 5 years in dealing with anatomical Latin, which I'm not talking about today. And I'm the only Latinist now who actually does research on that, which is kind of amazing. And also dealing with clinical terms in such a way that you're interacting with people who use them daily. So one of the things I'd like to do is, and I'll mention in a second, is build a relationship, because we're the people who are going to be teaching the medical language. We should be talking to the people who are using it. And so I would encourage anybody who wants to know a little bit more about how could be taught and how we can do collaborations to reach out to Amanda or Kelly, because they are really, really great people to work with. And we are a great resource because, you know, we know the language you use. So please, please use us. Now, things people don't think about quite often. In medical terminology, there is a division, things I'm sure everyone knows, between clinical terms and anatomical terms. Usually if I'm talking to people who are not in the medical faculties, I'd say simply, anatomical means you're naming parts of the body, clinical means you're talking about problems or regular things that go on. And you can see on the side here, the English side are things everyone's familiar with: arthritis, hematidrosis, and all the rest. Almost all the forms in those English clinical Greek terms are Greek, come from the Greek. And almost all the forms when you're naming parts of the body come from Latin. Fair enough. Okay. Almost all. Dermatitis, I highlighted here, dermatitis is Greek. Okay. So there is some crossover. Sometimes people make a mistake in teaching medical language and they say the Greek and the Latin, they never intertwine. Well, that's not true, because you can see at the top of this slide, there are 2 clinical terms, faciocephalalgia. Facio happens to be Latin, and then we have prosopoplegia. Prosopo also means face, that's Greek. And then in anatomy, we have at the top here, renis, which is of the kidney, and then we have nephron, which is Greek, the kidney. So they can interact, they don't have to be divided. One of the things in dealing with taking these terms apart is that we encourage learners, when you're looking at medical terms, to really simplify the language. So most people in this room, you know the shorthand, that's why we call it terminology. It's a secret language, a slang. Most people in this room up here will say thoracic vein because it's just how people talk. Latin would be vena thoracica. Nobody talks like that. What I do in the classroom is I get students to say vein pertaining to the chest, because I want the students to know that thoracic is an adjective. And as I say to the students, you go out in the real world, you're going to go back and say thoracic vein because that's how people talk, but I want to hear you spell it out. And along the same vein, if I can use that idea, when we're formulaically taking apart all of these clinical terms, we get students to use the kinds of language that emphasize that they understand the relationship. So arthritis, pretty straightforward. It's always the inflammation of what's in front of it, the joints. Hematidrosis, osis indicates you got a problem. Hydro is sweat, so it's an abnormal condition involving sweat. How do we account for hemat? Well, we say involving blood. We don't know how it involves blood. If you really want to know, look it up in the dictionary. But coming up with a formula, we say it's an abnormal condition involving sweat that somehow involves blood. So the thing is that I get the students to recognize is when they're putting the words together, these long clinical phrases, we have to think, yes, what does the termination mean? Is it a noun? Is it an adjective? And if it's a noun, what is the formulaic approach to this? I have a handout at the front. Some of you picked it up. The very first page has a common vocabulary list for terminations. Medical terminology is, especially for clinical phrases, is incredibly formulaic and incredibly reliable. So one of the things that we get students to do is to say, whenever you see a term ending in osis and the thing in front of it's a part of the body, it's an abnormal condition involving that thing. Whenever you see itis, it's always the inflammation of the thing that's in front of it. So we need to figure out the formulas. One thing as well, when you're dealing with medical language, obviously we know precision is important, because if you don't have things right, you could have all kinds of problems. But along with that, one of the things I ask all learners to do whenever they see a term, they should say, why does this word exist? And what is the point of having this form in the term? So I wanted to start off by giving you two terms, some real terms. And I thought it might be interesting if we did this, we started this way, wrong answers only. So here are two real terms, oropharynx and retropharynx. Everyone in the room probably recognizes what these are. Maybe you didn't think about this, but they're both nouns. Okay, they're both naming something there. And one of the things I ask my students to do, my learners to do, is to say, why did anyone come up with this term? So obviously, they're based on the word pharynx. So if we look at oropharynx, and I'm going to start off with giving you a wrong answer. If a person defined the oropharynx as the pharynx of the mouth, you would pause rightly and say, because usually when you're dealing with medical language, you read backwards. Okay, you start with pharynx, then go to mouth. And if anyone said the pharynx of the mouth, which is what you generally try to do, you try to subordinate when you go from one part to the other, you should rightly pause, because to say the pharynx of anything suggests you have more than one pharynx. Reading backwards, if you have cell or if you have muscle, you can say muscle of or cell of, because we have muscles and cells everywhere. So that's totally silly, right? What about a legitimate other possibility? Somebody defines the oropharynx as the pharynx and the mouth. Now, apologies if this is pretty obvious to everyone, but I've spent basically the last 11 years of my life looking at medical language. And one of the things that I like to point out to people is that we don't have medical terms that describe this thing and this thing and this thing. There's no reason to have that. So why did somebody come up with the word oropharynx? Well, the basic idea is it's indicating a part of the body. It's the part of the pharynx involving the mouth. So somebody looked at this thing and said, we need a name for it. So this kind of compound noun formula works well in this context. Now, retropharynx, also a noun, coming up with a bad definition, wrong answers only, behind the pharynx. That's wrong because when you say behind the pharynx, that indicates it's an adjective. That would be retropharyngeal, so that doesn't work. All right, this is a cheap attempt at a joke, but if somebody defined a retropharynx as a pharynx from the 1970s, okay, I was going to say a pharynx that still listens to the Eagles, but I don't know if people would find that amusing, so that's clearly not the case. What is the retropharynx? Now, most people in medicine would probably just tell me it's this thing that does all this stuff. Formulaically, we know it's a noun. The retropharynx is called that because it's something behind the pharynx. That's how it works. So it's a noun. We don't know. You can't say behind the pharynx because that would be an adjective. What is this retropharynx thing? It's something behind the pharynx. And as I say to my learners, I have a PhD in Latin literature. I know enough anatomy and medicine to get into trouble, which means not much at all. So I tell students, don't ask me what the retropharynx is. This is formulaically what it means. Okay. Now, the next little step I wanted to get into in order to teach formulas with you, it's based on error and recognition, kind of what we were doing. And I've got, how many terms do I have here? I've got 10 terms. These all came up in tests in the last couple of years that I gave to students. And I'm going to start by showing you the wrong answers that students gave. Sometimes I think they gave the wrong answers just to give me a laugh because they did well on previous tests. And it's going to help us understand how we deal with formulas. Okay, all of these first 4 terms here end in IA. That means number 1, they're a noun, and it's the first thing on the handout at the top. Anything that ends in IA, if there's a part of the body in front of it, it's an abnormal condition involving whatever X is. So necrospermia, we can all take that apart. We know E is a noun, a problem, sperm is sperm, and necro is death. Now, one thing we do in medical terminology, we don't spell out exactly what things mean. Dictionaries, and if you're dealing with other learners or students or colleagues, you're gonna actually define 100% what it means because you want to know exactly what you're dealing with. What we deal with when we're taking words apart is a formulaic understanding of terms, because these words were put together in such a formulaic way. And the silly yet fundamental error that the student made for this is they tried to come up with an explanation for the term, which we don't do. And the explanation is really silly. The student said an abnormal condition involving deadly sperm. And again, I think they were trying to make me laugh. But the key to this is, how do we define this? We say an abnormal condition involving sperm involving death. Because how does it involve death? I always say to the students, or learners, excuse me, is that as far as we're concerned, I don't care how it involves death. We know it has to involve death somehow because it's in the word. If we really want to find out, we'll go further, but we're just breaking the word down. Now, trichocardia, the next one, cardi we know is heart and trick we know is hair. The student decided to come up with this term, which I think was just meant to try to make me laugh, an abnormal condition involving a hair like heart. And of course, that's silly. How do we take that apart formulaically? We say an abnormal condition involving the heart involving hair. How does it involve hair? Well, we can look it up if we want, but that's not our purpose. We know that it's in the word because it has to involve it somehow. When you see it manifested in the real world, then you're going to look it up and you're going to figure it out. But formulaically, why is tricho put in there? Because it has to involve hair somehow. Trichoglossia, so trick is there as well, and gloss means tongue. The student decided to write for this. These were all different students. An abnormal condition involving the tongue in the hair. Maybe that's plausible, but that's just silly. So it's an abnormal condition involving the tongue involving hair. How does it involve hair? Who knows? And the final one on this page, acrocephalia. Cephal is head. Acro is extremities, can be the outer parts of the thing, or it could be the limbs. In this case, because it's in front of cephal, it's probably the outer parts of the head. The student wrote for this, I know it's coming up, an abnormal condition involving the extremities being in the head. Clearly kind of silly, but the best way around this is to say an abnormal condition involving the extremities of the head, because acro is working on a prefix. Okay, those were 4 that ended in IA. These next 3, pseudoencephalomalacia. So it's a noun. Malacia means the softening of X. That is on the front page of the handout. Encephalo is brain, and pseudo means false. So the student decided to write for this, and I find this a really interesting interpretation. The softening of a false brain. Now, I find this as a really helpful learning point, because basically, when you're talking about clinical terms that describe essential problems, for the most part, a term mentions one problem. Aside from the context of this, one of the key problems with this definition is you've got the softening of a thing, which is a bad thing, and also a false brain. Medical terms, clinical terms generally don't double the problem going on, because that makes things confusing. So what is pseudoencephalomalacia in the real world? It's the false softening of the brain, which basically means there is the softening of the brain, but this is the false softening. So it's a misdiagnosis, I guess. All right. Phlebotomist. So the concept of medical terminology involves thinking about how one cuts words, how one dissects words. Anything that ends in an ist reliably can be thought of as a person. Now, a problem that arises, now everyone in the room knows phleb is veins. Problem arises is how do you deal with OM and OT? And you can get yourself into all kinds of trouble because OM is generally the combining form for the shoulder. Now, as I tell the learners is that it's reliably the shoulder when it can be nothing else. And the only time it can reliably be the shoulder if it's at the start of the word. And OT can be the ear. OT is reliably the ear when it can be nothing else. But when it's when it can be nothing else is when it's going to be at the start of the word. So if you see OT showing up in the middle of the word and you see OM showing up in the middle of the word, probably not ear, probably not shoulder, but the student wrote this, one who specializes in the shoulder and ear veins. All kinds of problems there. Now, one of the keys to this, and speaking of cutting words up, is there's a general principle in medical language. Is the simplest reading is usually the best one. And instead of having OM meaning shoulder and OT meaning ear, you can just think of the letter O here after phleb as a combining vowel, and the TOM comes from Tommy, which is cutting. So it's one, not that, one who specializes in the cutting of the veins. Keep it as simple as possible. Now, number 7, everyone's probably looking at it, erotology, thinking, okay, I put this on a test, and as soon as I put it on the test, I thought, why did I do that? Because there's always going to be a student, a learner, who is just hearkening back to his 13-year-old days, and he wants to put an answer in that's going to embarrass me. But this wasn't what the student wrote. They wrote for this, the study of red ears. So eroto is from sexual desire. So they were thinking ero meaning one of the various forms of color red, but it's not quite that as well. And OT is only going to be ear when it's at the start of the word. So erotology is the study of sexual desire. Just 3 more here. Chylostomatoplasty. Any words that end in plasty, the surgical repairing. It's a therapeutic termination. And then we have stomat, which generally, well, it's going to mean, because chyle is lips, stomat is going to be mouth. And sometimes people look at stomat and they immediately think stomach, but if it's going to be stomach, it'll be stomach. So, but a student wrote for this, and this is an interesting way of cutting the term. They wrote the surgical repairing of a tumor involving the bone of the lip. And there's a reason for this. Plasty, of course, is surgical repairing of whatever's in front of it. Omat is a combining form for a tumor. And then ost can be thought of as bone, one of the forms of bone, and then chyle is lip. But of course, if you're reading that and you say bone of the lip, first thing that happens to me is I grab my lip and say, where's that bone? There is no bone there. So that doesn't work. All right. So the best answer is the one I already mentioned to you, the surgical repairing of the mouth involving the lips. Notice what I did here. I did not say the surgical repairing of the mouth of the lips, because that's silly. You don't say mouth of anything, because there's only one mouth. And I did not say the surgical repairing of the mouth and the lips, because the mouth and the lips aren't quite the same thing. How does it involve the lips? Has to involve it somewhere, somehow, because it's in the word. 2 more of these. Dacryocystostomy. Ostomy is the making of an opening in whatever's in front of it. If there's 2 things in front of it, and if it's reasonable, you get an awful lot of these in medical terminology, as you guys probably know. It's the making of an opening between those 2 things. Now, the student was looking at this and decided that cyst was going to be bladder, because it can be bladder. And they looked at dacryo, and dacryo can mean tears, or it can mean the tear sac if that doesn't quite work. And so the student, without giving much thought to it, wrote this as an answer. The making of an opening between the bladder and the tear sac. Oh dear, okay, so that's clearly wrong. Now, the neat thing is many people in the room know that dacryocyst itself actually is the combining form for the tear sac. So the making of an opening in the tear sac. So that was sort of goofy. And the last one that I want to finish with here, pseudo-alcoholic hepatitis. I think this is a really, we already did pseudo a few moments ago with pseudoencephalomalacia. But pseudo, when it's in front of an adjective, has an incredibly formulaic, easy approach to it. Now, hepatitis is hepatitis. Okay. So the student defined pseudo-alcoholic hepatitis this way. The inflammation of the liver, which is hepatitis, pertaining to false alcohol. And as soon as I see the interpretation of pseudo-alcoholic as pertaining to false alcohol, what goes through my head is, oh, wait a second, does that mean we got the alcohol from somebody who shouldn't have been brewing it, like someone on the corner? Now, people may not realize this, but almost 100% of the time when you have pseudo in front of an adjective, the way to define it is this, falsely pertaining to alcohol. And as I explain it to the learners, you're going to be my pretend, you don't have to talk here, you're my pretend doctor. Okay, I go to the doctor, you say to me, Stephen, you have hepatitis. I say, oh, that's not good. And you say, oh, yeah, it's not good. And then you say, it's because you're drinking, cut it out. So I just kind of, I walk home and then I realize, I don't even drink. So basically what that means is it's falsely attributed to. So formulaically, it follows into that pattern here. So how are we time-wise? Are we okay? Okay, good. Okay, so what I want to do within the constraints of where we are is I want to show you how in medical terminology, we use the terminations and we compare the combining forms, how we come up with formulaic approaches that don't really offer what's in the dictionary, because that's not what we're trying to do. Essentially, when we're reading terms, reading clinical terms, we have a formula for a termination, then we have combining forms, and we think about the relationship between the combining forms. And so I'm going to give you examples right here, and the medical term is in the brackets in the red, and so I'm going to give you a sort of fill-in-the-blank approach to these terms right now. So anything that ends in itis is the inflammation of X, and so for hepatitis, for example, we say the inflammation of the liver comfortably because anything that's in front of itis is inflamed. What happens, however, if you add another part to that, like pancreatohepatitis? Now, this is where I always say to the people I'm talking to, you guys are the experts. I'm a Latinist. I don't understand really health. I know you can't say the inflammation of the liver of the pancreas, because if you say the liver of anything, it means you've got more than one liver. Now, the question is it the inflammation of both the liver and the pancreas, or the inflammation of the liver that somehow involves the pancreas? And that's where I say, it's up to the people who are diagnosing it. If you say the both are inflamed, then you say and. If it's just hepatitis that somehow involves the pancreas, then say involving. You don't know. When we compare number 2 to number 3, we're moving from pancreatohepatitis to hematohepatitis. You can't say the inflammation of the liver of blood because you don't say the liver of anything, because you know where the liver is. And if you said the inflammation of the liver and blood, several problems should arise in your head, which is first, I don't know if blood can be inflamed, but even more importantly than that, you only use and if the two things are comparable. So the formulaic approach for this has to be the inflammation of the liver involving blood. And as I always say to the learners that I'm dealing with, if anyone asks, how does it involve blood? Our answer should be right off the bat, it involves it somehow because it's in the word. And if we really care, we'll look it up and find out, but we're not doing that. We're not. One of the problems with medical terminology, as it's taught in many places, is they just tell people, hey, here's hematohepatitis. You memorize the dictionary definition, which goes on for several sentences. That's not helpful for people. That's not helpful for medical learners who are trying to figure out their formula, trying to figure out an approach to these words without having to memorize more. So it involves blood because it's in the word. We'll figure it out along the way. The next one, cardiosis. So this is on the first page of the handout that's down here. Anything with that ends in osis is a problem. And if it's preceded by a part of the body, it's always an abnormal condition involving that part of the body. Ectopia. So if you're going off topic, that's displacement. So arthrectopia is the displacement of the joints. Pretty straightforward. Okay. Couple more. I think I've got about 15 of these. The next two terms here end in algia and odunia. We've got various ways of medical terminology to talk about pain. Understandably, there's a lot of pain one talks about in medical language. The one at the top, pain and then the hand. And so the basic way you deal with these kinds of formulas, chiralgia, is you say, okay, can the hand feel pain? The answer is the hand can definitely feel pain. So what is chiralgia? Pain in the hand. Again, you're my doctor. Okay. I come to you. Oniero means dreams, number 7 here. And you say, okay, I say, I'm feeling pain. You say, okay, where's the pain? And I say, in my dreams. And so lots of things are going on in your head right now. You're probably thinking, why did I get up this morning? Okay. Why couldn't I could be doing something else. So you don't say pain in your dreams because dreams can't feel pain. Formulaically, we have to say pain involving dreams because we're not trying to explain exactly how the pain is manifested. We're just saying, okay, there's pain and it's related to dreams. That's how that formulaically would work. The next term here is examination, the examination of, which ends in oscopy, like you're scoping, you're looking. And so in front of it is pneumon. Pneumon is always lungs, unlike pneumat, which is always air. So the examination of the lungs, fair enough. But if you go from the examination of the lungs, you can't say the lungs of anything because we know where the lungs are. And if you said the examination of the lungs and air, that means they're equal, and they're not. So formulaically, we grab our friend involving. What is a pneumonoscopy? It's the examination of the lungs, the process of the examination of the lungs that somehow involves air. And again, I've been being very repetitive. How does it involve air, someone might ask? Well, let's look it up. All that we care about for now is it has to involve it somehow because it's in the term. Compare that with the one on the bottom, number 9. The examination of the lungs, fair enough. But you could say the examination of the lungs and the heart, because why not? They're both organs. You could examine them at the same time. You could also use the phrase involving. Okay. And the last 5 of them here that I want to go through still emphasize these formulaic approaches. So number 10 ends in rexus. Rexus is always the rupturing of whatever's in front of it. So here we have phleborexis, the rupturing of the veins. And since the term in front of phleborexis is brachio, and since we have veins, even a guy like me who's not a medical person knows that there are veins in many places. Since we have veins in the arm, since we have veins in different parts of our body, here we're going to use the joining word of, because it's telling us, oh my God, I wrote legs, brachio. Brachio is the arms. Note to self. Pretend you did it on purpose. See if anyone noticed it. So the inflammation of the veins of the arms. Okay. So we say of as long as it tells us where it's going on. Now, for the one below, brachio and coneorexis, we say the rupturing of the elbow, as long as that makes sense. But if anyone said the elbow of the arm, I just had a midterm that 400 students wrote last night back at McMaster. And one of the disturbing things about people writing online exams is they take screenshots of the exam when they're not supposed to, and they send them to me. So I got home last night, and a bunch of students were saying, what's wrong with the answer that says elbow of the arm? And I had to think, okay, do I answer them right now because they're still writing the test? I didn't, but one of the things I will be telling them the next couple of days is if you say elbow of the arm, essentially for this term, you're saying that brachio is in the term because it's trying to tell us where the elbow is. They put brachio in this term, if it exists, because it's the rupturing of the elbow that somehow involves the arm. How does it involve the arm? Well, we can look it up, but it's not there to tell us where the elbow is. So one of the principles of dealing in with medical language is you ask yourself, why is this thing here? Medical language doesn't like to waste words. So this term here, and there's just 3 more, sanguinonecrosis. Necrosis is always the death of whatever's in front of it. And if we say the death of blood, you should pause and say, can blood really die? And so formulaically for this, we have to say that not the death of blood, but the death of something involving blood. And as learners will often say, well, blood cells can die. That's what something involving is likely going to refer to. But blood cells are not blood, okay? Exorrhagia, which is the rapid flowing of X. And the general principle is you only say the rapid flowing of X when X is a flowable thing. And as you can see on the front page of the handout that I provided, if it's a thing that doesn't flow, well, blood flows, lymph flows because the liquids flow. Most things don't flow, and glands definitely don't flow. So the formula you have to use in this case, because it's 100% reliable, adenorrhagia is the rapid flowing of, not of the gland, but of something from the gland. In this case, you can also reliably say, because you're dealing with the gland, you could replace that something with the rapid flowing of secretions from the gland, because in this case, what does the gland do? It just secretes stuff. And the last one that I would like to point out here, number 14, dermatobrachiodysplasia. The defective formation, it's always the defective formation of whatever in front of it. So in this case, of the arm. And then you can't say the arm of anything, because if you say the arm of anything, it means you've got, where's the arm? We know where the arms are. And since the arm and the skin are not comparable, we say the defective formation of the arm involving the skin. So this is a sort of an overview of the simple formulaic approach that I get the students to deal with when taking these words apart. We're still good time-wise, right? Okay, great. So to continue with this, I would like to mention, I think I've got about 12 terms here. This is from a non-published article that Dr. Hardman and I have been working on, and I've been negligent on in getting in putting the final version to the Canadian Medical Education Journal, basically taking apart some real medical terms and showing formulas. Some of the things that we've seen already. The basic idea in dealing with medical terminology, as I've said, you start off with the termination and you read backward. Exoplasty, whatever's in front of it, it's the surgical repairing of. So it's just setting the stage. What is rhinoplasty? It's the surgical repairing of the nose. So, but you start dealing with more difficult things, and you can see in brackets here, I'm cutting them up into their component parts. Cholecyst enterostomy. Ostomy is the making of an opening. In this case, because the two things that are in front of it, one can reasonably make an opening between those two things. So cholecystoenterostomy, that's the making of an opening between the entero, which is the intestine, and the gallbladder. So as long as it makes sense, it fits. And when you're dealing with gastrointestinal things, as I'm sure many people in the room know, you can do all kinds of making of openings between things in that part of the body. Laparocystectomy at the very top. So ectomy, one of the things I really encourage anybody who's learning medical language to do is to say things in English. Most people, when you see words like ectomy or terminations like ectomy, will say excision or removal. That's 100% fine. But the thing about the words excision and removal is those are Latinate terms. Whereas when you say the cutting out of, that's purely English. And so whenever I'm dealing with courses, I tell the students, say the cutting out of, because it really emphasizes to me that you understand what's going on. So laparocystectomy. So that's the cutting out of, and then in front of you, you've got cyst and you've got lapar. The thing to watch out for is if your word ends in ectomy, ostomy, or otomy, and you've got two parts, the one at the very start of the word is laparo, that's the abdominal wall. And so the formula for this, it's going to be the cutting out of whatever's in front of ectomy by means of, or through the abdominal wall. And so this case, the cyst is the bladder. So this is the cutting out of the bladder through the abdominal wall. And this formula works really well and predictably well. Number 4, nephrolithotomy. Now, a lith, as most people would gather, is a calculus. It's a stone. And most people, if they're thinking of what you do with a calculus in the human body, is you want to remove it. What's really curious is the term lithectomy is never used. It's always lithotomy. So this involves an asterisk in our learning process, is when we define lithotomy, we define it as the cutting out of a calculus. And in this case, the nephro is the kidney, cutting out of a calculus in the kidney. Number 5, parotomatogram. So we would cut it properly like this. A gram is not to be confused with a graph, which is an instrument for recording. A gram is a record. It's not a graphy, which is the process of the recording of X. So we have a record of an OMAT, which is a tumor, and this involves the parotid gland. And the reason why it's called the parotid gland is para is a prefix meaning beside, OT means the ear, and that's why it's called the parotid gland, because it's beside the ear. So the formulaic way to say this is a record of a tumor involving the parotid gland, or bad joke coming, as a student wrote on a recent exam, a record of something beside a tomato, which I thought was kind of cute. All right. Pneumarthography and pneumothorax, number 6 and 7. These are real terms, and they are frustrating because pneumon is always lungs, pneumat is always air, but pneum can be either. So I think I like to live in a world where people just say pneumon or pneumat. Don't leave it hanging. But these are real. So pneumarthography. Graphy is the recording of X. Arthros, of course, is the joints. So you say the recording of the joints, and then you say, oh, wait a second, is pneum going to be lungs or is pneum going to be air? You know, from my perspective, if I put those on a test and a student wrote the recording of the joints of the lungs, and they say, I don't know whether the lungs have joints or not. If they said that, I probably would give them full value. But if I put this on a test, I would probably tell the students, because I don't want to argue with them, I would actually change the word to pneumat orthography, because it actually means air. So it's the recording of a joint that somehow involves air. We compare this with this very real term, pneumothorax. Pneumothorax. Now, if you remember at the start of today, where I mentioned like retropharynx and whatever the pharynx term that was at the first, as a noun, here we have a similar noun. We have a pneumothorax. And one of the things we should ask ourselves, because in this case, pneumo means air, we should ask ourselves, why does this noun exist? And unlike when we had the part of the larynx involving the other thing that we talked about, this kind of phrase, when we start with gas or liquid, is not a part of the body, but it's indicating a problem. So this is, formulaically, we just define this as a collection of air in the chest. So, and then laryngopharynx is following the other strategy, the one we talked about earlier. Why does this noun exist? It's not the pharynx of the larynx, because that's silly. And it's not the pharynx and the larynx, but somebody looked at this part of the body and said, this needs to be defined as the part of the pharynx involving the larynx. So keep it as simple as possible. And 3 more that I want to deal with. Hemoplastic, this is an adjective. One of the things that I try to tell people dealing with medical language is that we're essentially only dealing with 2 parts of speech, nouns and adjectives. We're not writing sentences. You're just defining problems. Anytime you see an adjective, you really should say it has to be modifying a noun. So if I give you the word interesting, what probably pops into your head is, what is interesting? Something has to be interesting. And if I give you hemoplastic, you're thinking there needs to be a noun there, a hemoplastic thing. This is one of the things that I often fail in, especially at the start of a med-terms course. And whenever I have an adjective, my imagination kind of fails when I'm trying to think of an appropriate noun. So I end up saying things like, I impose a noun like problem, a hemoplastic problem, or something like that. Now, the problem with plastic as an adjective, and this is on the first page of the handout I provided, plastic comes from 2 forms, 2 possible forms. It can be diagnostic, which is exoplasia, which is the formation of X, or it can be therapeutic, which is plasty, the surgical repairing of X. So I put this on a test a few years ago, and I made a fundamental mistake, which is I didn't tell the students what I wanted from them. And so I either received one of 2 answers. So the standard way of indicating you have an adjective is to use the phrase pertaining to. Students wrote either what I wanted, pertaining to the formation of blood, or they wrote pertaining to the surgical repairing of blood. Boy, I did not know how to deal with pertaining to the surgical repairing of blood. And that caused a discussion in my classroom, which was not appropriate to my classroom because I can't have that kind of a discussion. But so I learned from that, if I wanted people to write from exoplasia, I would tell them that. So pertaining to the formation of blood. Phrenoptosis, the second to last one we'll be looking at here. Ptosis is the downward displacement of. And phren, of course, well, don't anyone want to take a guess at what phren is? What a lot of people would immediately think of phrenology. Phrenology is the mind. And what makes it so easy here is, at least in classics, they think phrenology, is that when you're dealing with a clinical term and you're talking about downward displacement, that's a physical thing, the mind is an abstract thing. So you actually can't ever say the downward displacement of the mind. And of course, phreno also means the diaphragm. And the reason why I'm mentioning this right now is that these are all, the forms here are all from ancient Greek. And you think phreno being the mind and phreno being the diaphragm. And, I want to be careful here because maybe, an ancient Greek person could walk in the room and be insulted by what I'm saying. But the ancient Greeks really did not understand the human body. They thought the mind was here. So they probably understood it better than I do, but I mean, there we go. Now, the last term that I want to mention, number 11, we'll deal with this here. Brachiokinetalgia. See if I define brachio as arm correctly here. Algia means pain. And you say pain in something if the thing can feel pain. Kinet, oh my God, there's a T typo there. So it's kinet, my apologies. Brachiokinetalgia. So brachiokinet, so from kinesiology, kinesis is movement. So movement can't feel pain. I got the no typo there. So you say pain involving the movement. Pain involving the movement of the arm. So that's how we deal with this term. Some people will see this term and pretend that T is not there as the typo there. Some people will look at it and they'll be too fast for their own good. They'll define brachiokinetalgia as pain in the arm when you move it. That's not what the term says. That means it's pain related to the movement of the arm. That means that you could have pain in your back when you move your arm. So anybody who defines this term as pain in the arm involving movement has decided, you know what, I'm going to go from there to there to there because I feel like it. And then you should ask yourself, why was this term written this way? This term was written this way because it was trying to talk about pain that's related to the movement of the arm. If it was going to be pain, pain in the arm involving movement, it would be kinetobrachialgia, but it isn't written that way at all. And pretty much that's what I wanted to present to you about how like a basic approach would be for medical terminology. And for those of you who are looking at the handout, a couple of things I might point out. You may look on the back page and be confused because I did not indicate what exactly this is all about. I teach at McMaster Medical School. This is the 5th year. I teach a 6-week class. I put random dates in there. It's going to be starting in a couple of weeks. That basically is an introduction to medical language. I think I'm fair in saying this because it's sort of an open class for anyone in medical school. If anyone's interested in being added to the Zoom for it, because it is Zoomed, you're more than welcome. You just send me a message. My card is up there too. So I'd be happy to include you. And if anyone wants to know anything more, how to probably learn about formulas and how to bring this into your workplace, your education field, either please reach out to me or reach out to my colleague, Dr. Hardman here, because as I said at the very start, one of the things that I find very exciting about teaching medical language is recognizing, number one, that it's not taught very well anywhere. And it's an opening where, because we teach it and we're trying very hard to teach it very well and in a formulaic way, we want very much to interact with you guys because we want to take a part in doing something that we think is very valuable. So that's my presentation, and thank you. Oh, sorry.
Thank you very much, Dr. Russell, for a great talk. Any questions in the room? Yeah, Dr. Gibbs.
Oh, yes, my turn. Thank you. A slightly loaded question given my ethnic origin. Where do you stand on the use of ligatures and diphthongs in the Department of Pediatrics and Hematology are misspelt? And esophagus
This may be an unfair way to respond, but how many people in the world of anatomical nomenclature are you friends with?
Just one now.
Okay, because one of the points I made when I was talking to the classics department yesterday is that I've recently signed off on a few articles where I make recommendations in like histology of increasing diphthongs, because that sort of goes along with what some people say is traditional. But as the argument that I pointed out is that I don't necessarily agree with it because I was just outvoted. So my shorthand is that one of the things that, like, for example, with blood, if you say HEM or HAEM, I have to recognize that we live in North America and speak English like North Americans. There are other people who look at those diphthongs and say that they're appropriate and all the rest. I tend to think, even though I want to avoid like sort of like the North American imperialism, I tend to think that those diphthongs create more problems than not. Like, for example, in anatomy right now, people are writing esophagus with OE. Yes, it changed 5 years ago. And I find that unhelpful, because there are some people, and this is like a little bit of a side note to what my other project in dealing with Latin anatomical nomenclature, is that there are some people who I think have a little bit too much time on their hands, anatomists, who look back and say, oh, this is how it was written in the 1600s. And one of the things, this is what's so exciting for me about dealing with medical language. I call it being radically practical. Like, as a classicist, I've talked to numerous people lately who want to do articles with me, and they say, oh, let's go back and talk about Vesalius in several centuries ago in his anatomy books. And my response is, okay, that's fine for somebody else. I want to deal with how it's used today. Diphthongs, I think, are not good for people today because it just makes it harder to read. And so on the one hand, avoiding the cultural imperialism of being North American and not liking them. But on the other hand, I think if you want a universal language, make it as simple as possible. So I hope that answered.
Rebuttal? Okay.
I will continue to split.
Okay, okay.
Any other questions in the room? Hey.
Do people have a favorite complicated medical clinical phrase? No. Okay, let me see. I once, for a test, because I didn't have very many students show up to a class. And so I said, okay, for the next one, if people want to get a bonus point, they had to write what I think is one of the longest medical terms, cholecystocholangiocholedocectomy. And they had to write it, and they had to get it correctly on the test. So I also told them if they ever had somebody standing on the bus too close to them, they just repeat it over and over again, and they'll walk away from them.
Now, is this being taught in medical school here?
No, it's this. So
Okay.
this is what one of my projects is. I don't think so. I do this 6-week thing that is at McMaster, but I don't think it's being taught at medical school anywhere. So there's the International Congress in Academic Medicine in Halifax in April, and I'm hoping to give a workshop there to encourage the faculties of medicine to think about doing this, taking it up, figuring out formulas. And so this is one of my ways to sort of reach out and say, if anyone's interested, I mean, the way if I sound flippant here, I have a full-time job, I have a tenure. I'm paid to do a little bit of research, but mostly I'm a teacher, and I believe very much in what I'm doing. So what I'd like to do is sort of to make a mark on the world, which is to, like, one thing I think we can do better in Canada is sort of add to our program without getting students to memorize things, basically helping them along the way understand the formulas they see. And so I'd like to participate. When I talk about ulterior motive, it's just to make education better. So I'm kind of hoping that somewhere along the line, someone's going to hear this and reach out to me and say, let's work together. Because I think that's the educational goal we all have, right? Something like that. Yes.
Curricular time is a incredibly sought after commodity and so limited. Is there a possibility, or have you considered creating like an asynchronous online or module or something that then could be distributed more nationally in a uniform fashion?
Well, here's if I can throw this out. I've considered it, but what I'd like to do is to partner with somebody. And I can say this, if the University of Alberta wanted to partner with us and then be the one that distributes it, I'm all good with that. Yeah, the University of Alberta could take the glory for it. Whatever. So to me, it's just a matter of I think there is a need for it, and there's a need for it to present it to people that they don't feel overburdened with extracurricular time. Because, for example, this class I teach at McMaster, I put air quotes around class because there's no grades. It's all on Zoom. Students show up, and I have wonderful interactions with them, but I know that they're very, very busy. And so, but after like a 6 weeks in a row for 1 hour sessions, I feel they've learned a lot. And so I'm happy to, like, for me, it's absolutely ready to go. It's just a matter that I sort of need somebody to want to try it out. So if it's not rude to turn it back, if you know people around here who'd like to talk about that, I think, Amanda, am I fair in saying we'd be happy to talk about that? Okay. Okay. But maybe some people are hearing, who knows? There is a Zoom thing going on. I don't know exactly where.
Okay, there's a question online. Why is the word osteoarthritis not involving any inflammation despite the itis end? In French, we say arthrose for short term, which is less confusing.
Can I look over your shoulder? So,
Yes, absolutely.
so osteoarthritis, formulaically, we would say the inflammation of the joints. And then this is where I always take metaphorically a step back, not too far because I can't read it anymore. And then say, we don't say joints of bones. So we'd say the inflammation of the joints and the bones or involving the bones. So what I'm worried about this, Quentin, who wrote this, why is the word not involving any inflammation despite the, so this is where I would need, and I apologize for this, I would need to look it up and find out exactly what it does mean in the dictionary and then find out how it evolve. So if you see osteoarthritis, I would definitely define it as the inflammation and then say, okay, maybe it has originated in another place. So Quentin, I apologize, this is not a fair answer because I have not encountered this term recently. So, but yes. Okay. But I'd want to know like how did,
But I
like
wonder
at
if
some
it
point
means-
it was considered an inflammation or something like that.
But could it be like inflammation of the joint? And this might not be the Latin way, but in a bony fashion, because in osteoarthritis, you have bony overgrowth.
Well, my understanding, just reading what Quentin wrote here, is that if I'm reading it correctly, it says it does not involve any inflammation. So this is where I will say I cannot compete on, you're on a different level of knowledge than I am here. So.
I think originally they thought osteoarthritis did involve inflammation, and it's only more recently that we realize it's less that way.
Okay.
But that's my thoughts.
I want to run to my dictionary immediately.
So evolution of the pathology as opposed to, or of the understanding of the pathology as opposed to.
I know a lot of psychology terms, the origins of like basically are misdiagnoses of things that people thought were physiological problems.
Okay, any other questions? Well, with that, I will say thank you very much,
thank you.
Dr. Russell.
Thank you for having me. Appreciate it.